Please indicate your presence by signing in on the roll. Close. Please close the roll. Do we have a quorum? We have 5. Quorum is present. We will get started. Excuse me. Welcome to Behavioral Health. We have an ambitious agenda to get to today before a full committee, so we're going to try to keep this rolling along. Delegate Sayre, since you have a conflict, you asked if we could take your bill first.
Thank you, Madam Chair.
There. What's your
Good
bill
morning.
number, sir?
Members of the committee, the right to choose our food, to make that choice based on where it came from, how it was raised, who raised it, or whatever other factors are most important to the consumer is a fundamental freedom worth regaining. This bill seeks to make that right available to all Virginians by expanding exemptions from state inspections for small-scale homemade food production and sales in private homes and farms, thereby promoting freedom for low-risk, direct-to-consumer transactions. Current law exempts foods like jam, baked goods, and certain pickles sold under strict conditions, but private residents and farmers from broader one-on-one sales at temporary events. HB 699 seeks to amend the code to address this by adding a new exemption allowing private homes or farms to sell any food without inspection if it's sold in person directly to consumers at the home or farm for personal use, not resale. This does not grant any additional permission for sale at temporary events or at farmers markets, and all this is provided products are labeled with the seller's name, address, phone, preparation date, and disclaimer. This key change empowers residents and farmers to offer homemade goods without bureaucratic hurdles while ensuring transparency through labeling so that buyers are informed of no state inspection. This bill ensures Virginians food freedom and helps local agriculture grow by reducing red tape and supporting consumer choice, all without new costs or mandates. Grounded in fairness, freedom, and economic opportunity, this measure strengthens Virginia's support for local food systems. And I thank you for your consideration.
Thank you. Do we have any questions from the committee? Is there anyone in the audience who'd like to speak for this bill in support? Anyone who would like to speak in opposition of this bill, please line up.
Good morning, Madam Chair, members of the subcommittee. Trey Davis with Virginia Agribusiness Council. Respectfully to the sponsor, we urge you to oppose this legislation. We've had long-standing policy, in particular against the sale of uninspected meat and unpasteurized milk. That's primarily driven from a food safety and public health concern. Our farmers, meat producers, milk producers work very hard to make sure their products meet both state and federal standards in selling to the public. Our state meat inspection program, which this bill would kind of throw into a weird position, is approved by VDEX through a cooperative agreement with the federal government. So allowing the sale of uninspected meat, in particular at any level, would put our own state inspection program in danger. Also speaking on behalf of the Virginia Cattlemen's Association that share the same concerns and respectfully would ask you to oppose the bill. Thank you.
Thank you. Next.
Madam Chair, members of the subcommittee, Eric Paulson with the Virginia State Dairymen Association, representing Virginia's dairy farm families, and we stand in opposition to this bill. Thank you.
Thank you. Yes, ma'am.
Madam Chairman, members of the committee, Martha Moore with Virginia Farm Bureau. I'd like to echo the comments of Trey and then just add also, if we lose the state meat inspection program, that impacts all of the other people who are selling meat from inspected facilities because they would lose that capability. So that's the only additional thing I'd like to add to his comments. And we would ask you to oppose this bill. Thank you.
Thank you. Do we have anyone online in support of the bill? I think we have one. Yes. What's his name?
Is this his?
Yes, go ahead, sir. You have to unmute.
Okay, is that me?
Yes, that's you. Thank you.
Okay, so yeah, I support this bill. I do believe that the delegate is going to offer an amendment to satisfy the those who have opposed the bill. But my name is Dwayne McIntyre. I'm a farmer out of Russell County, Virginia. I'm also a member of the group VICFA, who is in works with the delegate to have this bill pushed forward. So one of the things I just want to kind of mention is that, we bought our farm back in 2019, but there was no way we were ever going to do that if it wasn't for the exemption programs already in place in the state law. We started a chicken operation back in 2012, and it was just, 20 birds. And under that exemption, we didn't need to have all of the costly regulatory things to implement our chicken program. And so we just started very basic, and we got to put our foot in to see if we could even entertain the idea of doing chickens. Well, it turned out to be pretty successful. It allowed us to slowly buy implements and more equipment and stainless steel and all of the things that have helped us build our chicken program under that exemption. And by time 2019 hit, that and some of the other stuff we were doing just allowed us the viability to purchase a farm and to actually engage in farming from square one. And then when we bought our farm in 2019, it was because, we had this opportunity. We didn't need $100,000 up front. We just, we started one step at a time, and it allowed us to do this. And then 2019 rolled around, and we bought our farm at the end of the year, and within 6 months, COVID hit. And we lost all of our restaurant contracts. We lost, our ability to go to the farmers markets and to sell directly to the customers for quite a few months. And what ended up happening was a lot of customers came out to the farm. And the only thing that kept us alive, if we were just chicken or if we were just beef, because we are a beef operation, a chicken operation, and we also are Russell County's only grade A dairy. We built a micro dairy on the farm, which allows us to milk the cows and to pasteurize the milk, and then to sell it to the public. And so if it wasn't for the diversity, we would have not been able to survive COVID. And so this bill offers a lot of extra diversity for people for not just other people, but for us to, instead of just having to invest a whole bunch of money into an idea before we know that it works, this bill would allow us to just kind of try out this and try out that and see where the viability is, and then engage. If we found a product that we made that people like, then we know that we can invest more money into it, meet more regulation, be able to come off the farm, because this farm restricts us to only be able to, or this bill restricts us to only be able to sell on the farm. And then we'll be able to, just kind of soundly invest in our farm without taking big, giant risks and losing everything. So that is what I'd like to.
Thank you, Mr.
Sure.
McIntyre. Anybody else for the bill online? In support of the bill?
She's against.
Against the bill? Dr. Hutchinson?
Yes, thank you, Madam Chair.
1 minute,
Virginia
please.
Farmers Market.
Go ahead, I'm sorry. Did we lose you? Did we lose her, Madam Clerk?
I'm here. Sorry, Madam Chair.
Oh, go ahead. 1 minute, please.
Thank you so much. I'm with the Virginia Farmers Market Association. We represent over 20,000 farmers and small vendors in the Commonwealth of Virginia that sell at over 365 farmers markets that operate throughout the Commonwealth. We oppose this bill. We feel that there are grave food safety concerns as well as public health concerns. There is a risk regarding the liability impact on small food businesses in the Commonwealth. We feel like this has the ability to undermine consumer confidence in buying from small food businesses because of the food safety issues, and that it would be potentially detrimental to locally grown and produced products here in Virginia. So therefore, we oppose House Bill 699 for these reasons. Thank you.
Thank you.
Do we? I guess he just shut up. He's for the bill, I guess, but he has to put on a video. His name is Dan.
Dan, you're wanting to speak in support of the bill? If so, you have to put your camera on.
Okay.
You have 1 minute, sir.
Okay. I don't know why this landed before behavioral health, but maybe it's because of our behavior. But in any case, there's a lot of evidence now that quality of foods and the nutrient quality of foods affects behavior. There's lots of interest in reducing the amount of ultra-processed and pesticide-contaminated foods for improving behavior and mental health. And this would be one way of allowing that to happen, because you're getting directly from small producers who cannot make ultra-processed foods. And generally it's from small growers that aren't using massive amounts of pesticides or other food additives. The other thing that is very important is that many small producers are interested in doing more processed foods, but they're scared to do it because of all the red tape and permitting process. They're very intimidated by that. So some of them
Thank you.
prices.
Your minute is up. Thank you, sir. Bringing it back to the committee.
Madam Chair, at the appropriate time, I'd like to make a motion.
All right.
I had my button pressed to speak.
I'm sorry. Yes.
Madam Chair, a couple comments and then a potential amendment to the bill. First off, we heard a lot of great testimony, and one thing that stood out from one of the gentlemen was that he was able to engage with producing chicken because there was some limits on an exemption. And I heard some of the concerns about beef and dairy. And so, Madam Chair, I think that it would be prudent to offer a friendly amendment if the delegate would be open to this, to exclude beef and dairy for the time being, so that we could come back to this and then maybe create some limits for beef and dairy similar to that of the chicken industry, so that people can get their foot in the door and try to grow that business in a safe way for the community. And so that would be my friendly amendment that would be offered if the delegate would accept that and the committee would accept that. To exclude
Madam
beef
Chair,
and dairy at this time.
thank you to the delegate. Yes, I anticipated those being concerns, and so I've actually written up what I think would be an appropriate amendment. How should I handle this? Should I give this to council? Should I give this to?
You can state the amendment and share it with the council, please.
Those are just thoughts on how that might look, and how that might work.
Do they vote on the amendment? Yes. So she has to voice vote on the amendment.
Describe the amendment.
He's sharing it with the council.
Council, would you please report the amendment?
Madam Chair, on line 72, this would add after food other than meat products and poultry products as defined in 3.2-5400 and milk or dairy products as defined in 2 VAC 531-10, which are otherwise unlawful to sell. Additionally, on line, I believe 80, or it might be line 77 in the introduced bill, after inspection, insert 5, if such food is a meat food product or poultry product as defined in 3.2-5400, and such meat food product or poultry product is prepared by an official establishment as defined in 3.2-5400, it may be sold in accordance with the subdivision.
Madam Chair, I move the amendment.
It's been moved and properly seconded that we adopt the amendment. All in favor say aye.
Aye.
All those opposed? The amendment carries. Now the amended bill is before us.
Madam Chair, move to report.
Second.
As amended.
And before-
Madam Chair, I have an alternate motion at the appropriate time.
It's the appropriate time.
Madam Chair, I move to pass this bill by indefinitely.
Second.
There's been a motion made to pass this by indefinitely. Does that require voice vote? It's a recorded vote. All those in favor of
Just a
passing,
second, I have to, it's a recorded vote. I have to put it up.
1 minute.
I have to open the vote. Okay.
All those who wish to vote, please vote. The roll is open.
You have to vote.
Close the roll. This bill will be passed by indefinitely by a vote of 4-2. Thank you.
Thank you, Madam Chair, and thank you for getting me in. I'll head to the next committee.
All right. All right, we will go back to the agenda.
May I do one thing for you so you can get this more easily and just move it down here?
Delegate Hope.
Good morning, Madam Chair. It's great to see you this morning. I got House Bill 225, and I do have a line amendment.
Go ahead with your amendment. Would you like counsel to read
Mr.
it?
Brooks, yeah, would you report the line amendment?
Madam Chair, there's one line amendment on line 101, introduced after department. Insert, notwithstanding the written plan developed pursuant to subdivision B2, the department shall have the authority to adjust and update the task force membership.
Thank you, Madam
The
Chair.
amendment is before us.
Thank you, Madam Chair. House Bill 225 is amended. This is a Behavioral Health Commission recommendation. It would create a Marcus Alert Evaluation Task Force to review the effectiveness of the Marcus Alert program. The problem that we've had in the past is that we've had a task force in place, but they haven't met because there hasn't been an agency responsible for it. And so this bill puts that onus on the Department of Behavioral Health and Developmental Services to convene this work group. So that's the bill that's before you. I do have a budget amendment. I don't know that there is a fiscal impact on it yet, but I believe that there will be. So, you know, if you subcommittee wants to move favorably, I'd like to see you send it to appropriations, and maybe between here and full committee, we can work out whether there is a fiscal impact. But I do have a budget amendment in anticipating that there will be a financial cost to putting this task force together and reporting out on the effectiveness of Marcus Alert.
So you're asking that we send it to, refer it to appropriations? There was some confusion as to whether it should go or not go. And so
I've been here a long time, Madam Chair. As abundance of caution, I anticipate that there will be a fist it's coming, and I'll be prepared for that.
all right. Anyone,
That's the case.
committee members have any questions? Anyone in the audience in support of this legislation? Anyone opposed? No one's online?
No, just 309.
All right. We bring it back to you, Delegate Hope.
I appreciate the subcommittee's attention to this very important matter.
So this bill has been asked to be referred to appropriations, so we
With an amendment.
work by motion and by amendment, and with amendment.
And Madam Chair,
Yes?
I move that we report HB 225 as amended and refer to appropriations.
Second.
It's been moved and properly second that we report and refer the bill as amended. Will the clerk open the roll? Please vote. Please close the roll. It is reported and referred 5-1. Thank you, Delegate Hope. Your next bill?
Thank you, Madam Chair. House Bill 309, and I do believe there's a substitute.
Madam Chair, there is a substitute. Substitute for HB 309 makes the provisions on custody a bit more specific. It limits the time a person for whom a physician is seeking a TDO can remain at a facility to 2 hours before a TDO is issued, and permits security personnel to take reasonable measures to ensure that they do not leave the facility as long as those measures are at the direction of a physician. It also specifies that the person shall be permitted to leave the facility immediately if no TDO is issued, the physician determines they do not meet the requirements for a TDO, or the person's legal guardian or person authorized to make an informed decision on their behalf rejects consent to the custody, testing, observation, or treatment. Substitute also enumerates that any licensed health professional, hospital, or security personnel assisting a licensed health professional involved in detention under the bill is not liable for a claim arising out of lack of consent to treatment, testing, or detention.
Move the substitute.
Second.
It's been moved and properly second that we adopt the substitute. All those in favor?
Aye.
All those opposed? The substitute is before us.
Thank you, Madam Chair, members of the committee. House Bill 309 fixes a gap in custody, and Mr. Chandler really read the meat of what we're trying to accomplish here. Everyone knows that when you go before a court or a magistrate and you need to get a TDO, if that order is granted, then that person can be sent for 24 hours to a hospital and be held to get stabilized. But sometimes people will show up at the hospital without a TDO. Maybe they're intoxicated. And so that period between showing up at the hospital and needing support and going to the court or a magistrate to get a TDO can be a lengthy amount of time. Not a ton of time, but between that time, the question is who has custody over that individual in the meantime. And so this bill tries to fix that gap during that brief period that they arrive at the ER waiting for that TDO. House Bill 309 clarifies existing law that's stating while the medical TDO is being sought, the patient who is unable to provide that informed consent at that moment remains in custody of that facility. The legislation also preserves existing statute that and clarifies existing liability protections for hospitals and clinicians acting in good faith. The bill does not expand the detention authority or the time that you can keep someone, just really closes that gap, defines that gap between those two periods in seeking that TDO, who has custody over the individual. The emergency physicians, the Virginia Hospital and Health Care Association, the DBHDS all work together on this substitute that you've just adopted to get into this point. It really identifies a real gap in definitions and clarifies who has custody. And that's the bill, Madam Chair.
Thank you, Delegate Hope. Any committee members have questions? Seeing none, anyone in the audience in support of the legislation?
Good morning, Madam Chair, members of the subcommittee. Amy Perrin-Seibert on behalf of the Virginia College of Emergency Physicians. We support the bill and we thank the patron for working with us on this, as well as the Virginia Hospital and Healthcare Association and DBHDS, so we could get the language correct. It does fill that necessary gap that my emergency physicians deal with on a regular basis when you're talking about a medical TDO. So thank you.
Morning, Madam Chair, members of the committee. I'm Colleen Miller from the Disability Law Center of Virginia. You may recall about 3 years ago the very, very horrible traumatic death of Irvo Otieno. The Disability Law Center did a detailed study of what happened in that, and one of the issues, there were just a whole bunch of things that went wrong in that entire incident, but one of the things that happened was the issue of who had custody over him while he was in the hospital was really not resolved. This bill will resolve that and hopefully will prevent any of those unnecessary escalations that happen in the hospital. Thank you.
Thank you. Anyone in opposition in the audience? We have one person online. You have 1 minute.
Hi, this is Dr. Sequeira from the College of Emergency Physicians. I know Amy spoke, and thank you, Delegate Hope, for sponsoring this bill. So as he did a great job of explaining, right, so when patients come into the emergency department, whether intoxicated, patients with dementia, patients who do have any disability, IDD, for example, trying to actively leave right now, it's tough because, again, no idea of who takes custody of that patient. And so this would allow the facility and our available security to take custody of that patient while we're obtaining the TDO. Unfortunately, right now, sometimes we have to go through courts, sometimes we have to call magistrates, fax a form. It's not a quick process. And can take sometimes an hour, over an hour, which is why we gave that 2-hour length of time to obtain the medical TDO, and being clear that it's very different from the psychiatric TDO. So thank you very much.
Thank you. Seeing nobody in the queue to speak, Delegate Hope, you have the last word.
I appreciate the subcommittee's support.
We operate by motion.
Madam Chair, I'd move to report as substituted.
Second. It's been moved and properly second that we report HB 309 and open the roll as substituted. Close the roll. The bill is reported with substitute 6-0.
Thank you, subcommittee.
Thank you, Delegate Hope. Delegate Martinez.
Good morning, Madam Chair and Committee. I do have substitute that makes changes in several lines on the bill, but does not change the intent.
Would you like to report, Clerk?
Madam Chair, the underlying bill, HB 513, is that correct? HB 513, yes. HB 513 originally put review of veteran and military service member suicide deaths under the auspices of the local and regional overdose fatality review teams. The substitute instead permits localities or combinations of localities to establish local or regional suicide fatality review teams. The statute is modeled after the statute that establishes the overdose fatality review teams, and the substitute permits the local or regional suicide fatality review teams to conduct closed meetings and make information records related to fatality reviews confidential and excluded from FOIA.
The substitute is before us.
Move the substitute.
Second. We already did it. Yeah. Delegate Martinez, it's you.
Thank you, Madam Chair. The legislation will build critical capacity for local suicide mortality reviews teams to share data on veterans and military-related suicide deaths to facilitate an understanding of the risk factors of suicide and determine what interventions are at individual, provider, facility, system, and community levels. Veteran-specific approach, military and veteran suicide involve unique risk factors, military transition stress, service-connected behavioral health concerns and or trauma, substance use disorders, etc., and access to care challenges. Suicide mortality review teams for military and veteran suicide deaths is a national best practice promoted by the U.S. Department of Veteran Affairs, and Virginia does not have this systematic review process, which is needed to inform a comprehensive public health approach to suicide prevention. In 2025, Virginia Department of Veterans and the Virginia Department of Health led a one-year pilot supported by the Veterans Affairs to conduct best practice training and build initial capacity for SMRs of military and veteran suicide deaths in Greater Hampton Roads. The pilot successfully built a team framework for local stakeholders to conduct comprehensive suicide death reviews in order to develop recommendations for direct services, care access, policy, and system change that will prevent further suicide. This legislation establishes a structure for local and regional SMR teams development to review military and veteran suicides through a collaborative process between DVS, VDH, and local expert stakeholders. The reviews will guide data-driven access care, to policy and system changes to help DVS and VDH and other federal, state, and local stakeholders allocated resources and promote enhanced suicide prevention, intervention, and postvention support. I believe we have folks from the Department of Veteran Services and maybe the Department of Health who are able to answer any questions for the committee.
Thank you, Delegate. Are there members, do we have any questions of the committee, first of all? Are there those in the audience wish to speak in support of this bill?
Thank you so much, Madam Chair, members of the committee. My name is Tate Jordan with the Virginia Young Democrats Disability Caucus, and we fully support and endorse this legislation. Thank you.
Anyone in the audience in opposition of the bill?
Is the substitute ready or not?
Can we go at ease?
The committee will go at ease. Delegate Martinez, I don't know why I want to get your name right today. We bring it back to you for the last word.
Say that again.
We bring it back to you for the last word.
Oh, I'm fine. Thank you.
All right. The committee operates by motion.
Madam Chair,
Yes.
motion to report as substituted.
Second.
All those in favor will go on the roll. Madam Clerk, open the roll. As well as opposed. Please close the roll. The 513 reports, what was the number again? Goes off really quick. Your bill is reported, Delegate Martinez.
Thank you, Madam Chair, and the committee.
No, I mean the 6-0. 6-0. Thank you.
Sorry, I'm sorry, the vote. I'll give you the vote before we go off. Okay, 6-0, sorry about that.
Next up, we have Delegate Anthony. I don't see her in the room. Delegate, we're going to pass by you and take Delegate Hayes, if that's okay. Delegate Hayes, you're up next.
681.
Bill 681.
Thank you. Thank you so much, Madam Chair, members of the committee. 681, Madam Chair, is a bill to assist with law enforcement agencies being able to give retired law enforcement officers emergency and temporary detention order capabilities. There exists an acute need to provide relief and support to our public safety departments throughout the Commonwealth in addressing the execution of temporary detention orders. Due to the amount of time it takes to carry out these orders, our public safety departments have been in need of assistance with these means of transport for many, many years, more than 20 years, actually. Madam Chair, members of the committee, it is imperative that the Commonwealth provide these essential transport services to ensure the humane and efficient processing of individuals subject to these orders. It is also imperative to provide the relief and reduce the strain on our public safety officers. And that, in essence, is what this legislation will do.
Thank you, Delegate. Any questions from the committee? Anyone in the audience in support of this bill? Anyone in opposition? There's no one online. Delegate Hayes, you have the last word.
Madam Chair, I had a question.
I'm sorry. One moment.
Question for the patron.
Delegate Henson.
A quick question. If we are utilizing retired officers, are there certain trainings that will be required of them in order for them to be in compliance in order to do this particular work?
Absolutely.
Thank you.
Absolutely.
Any additional questions?
Just a comment, Madam Chair.
Delegate Cherry.
Madam Chair, I thank the delegate for bringing the bill. This is an area that I've worked on since I got here, trying to alleviate the pressure on our law enforcement divisions that are spending many times thousands of hours sitting in a hospital somewhere. I use the term very gently, babysitting people who are in a mental health crisis, arresting them in essence, putting them in custody, and anything we can do to help alleviate that pressure, I am absolutely for. And with that, Madam Chair, I would recommend we report this bill.
Second. It's been moved and properly second that we report H. Bill 681. The clerk will open the roll. The clerk will close the roll. HB 681 reports 6-0. Thank you, Delegate Hayes. You're going to have another bill?
Yes, ma'am, Madam Chair. Madam Chair, the second bill is HB 695, and there is a substitute, an amendment in the nature of a substitute.
All those in favor? Aye. Would you like counsel to report the substitute?
Yes, please.
Madam Chair, the substitute for HB 695 changes who the statute applies to from restaurants with 3 or more locations in the Commonwealth to restaurants that are required to comply with 21 CFR Part 11 and Part 101. It permits restaurants to indicate high sodium menu items by using an asterisk or similar symbol, provided that they display the warning language in the statute somewhere conspicuously on the menu at least once. Bill also directs VDH to revoke licensure for a restaurant that does not comply with the statute, but also directs VDH to reinstate that license if such restaurant demonstrates compliance after revocation. And that license revocation component replaces the civil penalty that was in the underlying bill.
Thank you. Delegate Hayes.
Thank you so much, Madam Chair, members of the committee. As we all know, the dangers of sodium content, what comes along with that in many cases are dis-ease with regards to high blood pressure, hypertension, cardiac issues, and even in some instances stroke. And so what the bill is intended to do is address a few things. One, it's going to help consumers make healthier, informed choices. It's going to improve public health transparency. It's going to encourage menu reformulation of our menus over time. It's going to support people with dietary restrictions. It's also consistent with existing nutrition transparency trends. Madam Chair, members of the committee, this item was, or the idea was brought to me by a constituent a couple of years ago as she was the chief ambassador for the American Heart Association here in the Commonwealth of Virginia, Ms. Tamika Quinn, who's here today and would like to speak as well.
All right. She's online?
She's in the audience.
All right. She could come up, please. You have 1 minute, ma'am. Thank you.
Thank you so much, Madam Chair and the committee. My name is Dr. Tamika Quinn. I suffered 2 strokes at the age of 27, and I had heart surgery 3 years ago. It is imperative for me to maintain healthy blood pressure. My blood pressure increases, it directly impacts my health. I can feel a headache right away when I eat too much sodium, and being able to make healthier choices by the sodium being disclosed makes a difference in my life. And so this is something that I'm asking for you all, for not just me, but for all of Virginians.
Thank you.
So, Madam Chair, members of the committee, as you heard, although we had an unfortunate experience with Dr. Quinn, it's an issue all over the Commonwealth with individuals, and we're trying to address that issue. Finally, Madam Chair, members of the committee, I want you to know that I've been in conversations and collaboration with one, the Virginia Department of Health, as well as the Virginia Restaurant Association. They've all contributed to the language with this bill.
Thank you, Delegate Hayes. Committee members, any questions? Delegate Cherry and then Delegate Cole.
Madam Chair, a question for the patron. Many times we want to put some punishment in if someone doesn't comply with something. Yours has that we will revoke their license and being able to operate as a restaurant until they come into compliance. That seems harsh for this non-compliance. Like typically we'll start with a fine or something like that. Was that intent of the patron that we're going to go close down restaurants that don't put salt content on their?
Madam Chair, Delegate Cherry, I agree. It does appear to be somewhat harsh, but when we watch the lives lost, that's rather harsh as well. And so what I would say to that is this comes as a recommendation from the Department of Health, as the original bill was civil in nature. And after meeting with them, they thought it would be more effective to have the revocation of the license as a tool. So with that, Madam Chair, members of the committee, Delegate Cherry, I would say it will have people pay close attention to following that rule.
Thank you.
Thank you, Madam Chair.
Delegate Cohen.
Thank you very much, and certainly appreciate what you're trying to accomplish here. Just a question for the patron.
Yes.
Do you know how many restaurants are covered under 21 CFR Part 2 and Part 101?
I'm sorry, I missed the question, Madam Chair.
Delegate Cohen.
Yes, just asking the patron if he knows how many restaurants would be covered under 21 CFR Part 2 and Part 101.
Yes, Madam Chair, Delegate Cohen, the threshold is a restaurant with 20 or more locations. Apparently, these organizations already track sodium content and have that information available to them. And so the idea was to not have small businesses and small restaurants to have to adhere to these same requirements. And then, of course, Madam Chair, I want to share with you, if you interpreted my opening that the Health Department directed or recommended that the licenses be a part of that enforcement, it wasn't that they officially asked for that enforcement to be a part of their recommendation.
Thank you, Delegate Hayes. Anyone in the audience in support of this bill? Anyone in opposition? Please line up. You have 1 minute. Excuse me, Delegate Hayes.
Good morning, Madam Chair, members of the committee. Tommy Herbert, representing the Virginia Restaurant, Lodging, and Travel Association. First off, I want to say we appreciate the patron, appreciate what he's trying to accomplish here. We don't want anyone to not, excuse me, have knowledge about the nutritional information, at least where we can offer it, that is going into their food. However, we were not aware of the substitute. There is another restaurant association here that represents a much smaller group. Did you work with them on this language?
You, excuse me, you need to direct your questions
apologies,
to the
Madam Chair. We are not aware of this substitute. We found out about it when it was announced, and I just want to, before I even get into my comments, say license revocation is absolutely a bright red line. This is existential for restaurants here. I must say that. That is, the civil penalty would have been difficult to collect, but the license revocation will close restaurants permanently, and that is not exaggeration. But on the merits of the bill...
Sir, I'm sorry, your time is up. We get your...
Madam Chair, I haven't even gotten into our substantive comments on the bill.
You have 1 minute, and we are pressed up against time, so...
Thank you, Madam. I hope you'll oppose the bill.
Please, you can submit written comment if you would like. Thank you. bringing it back to the committee.
Madam Chair,
Any questions? Yeah.
Yes, Madam Chair, actually, I have an amendment, and I would like to, instead of shall, change to may. I'm just concerned about, and I totally appreciate where the patron is coming from, and, high blood pressure is extremely dangerous, and it does take lives. But I think that providing restaurants an opportunity to cure before, taking their ability to operate away would be, I think it's good. It will raise awareness. They will know. And I'm trying to find the line, Madam Chair.
30. Council.
Line 30.
Madam Chair, yeah, this would be on line 30, change that shall to a may. And additionally, currently once it's been revoked, the department shall reinstate the license if they demonstrate compliance, but Delegate Herring mentioned a time period and ability to cure. Is there a time period that the council or that the committee has in mind in terms of prior to revocation?
So, Madam Chair, I would ask council if there are current regulations or similar requirements for violations that we can maybe use as a guide.
Madam Chair, Delegate Herring, I would have to defer to VDH or get back to you on that in terms of what we currently do with regards to ability to cure. But
okay,
yeah.
And so, Madam Chair, I'm thinking that perhaps we just go by for the day, and it would be up to Mr. Uberchair if he wants to accept amendments during his full committee meeting, because I think it's an excellent bill. I'm very concerned about the penalties.
It's been moved and properly second that we pass this by for the day. Is this a voice vote? It's a voice vote. All those in favor? All those opposed? Delegate Hayes, we're going to pass this by for the day so you can work with the advocates and we can get more time to see what's happening with this bill. Thank you.
Absolutely. Thank you so much, Madam Chair, members of the committee.
You're welcome. Next up, we have, is Delegate Anthony here? All right, we will take Delegate Scott.
Thank you, Madam Chair. If it's okay, I'll just present from here.
Yes.
All right, thank you, Madam Chair. House Bill 1190, I have a line amendment if council would report that.
Madam Chair, there's one line amendment on line 26, introduced after 4A, strike private.
There's amendment before us.
Move the amendment.
Second.
All those in favor?
Aye.
All those opposed? Delegate Scott.
Thank you, Madam Chair. Now, with the amendment, we have removed both mentions of private. Let me find my place here. Waterworks from the code, and so this would apply receivership not just to private waterworks, but also to public waterworks. This small change empowers Commissioner of Health to petition the court for receivership, regardless of whether system is owned by a developer, a private owner, authority, or municipality. It ensures one standard practice for all waterworks, and I'd ask the committee to move favorably.
Are there any questions from the committee? Delegate Cohen.
Question for the patron.
Delegate Cohen.
Thank you. For those of us who may not be as familiar with waterworks as a person might think you would need to be on behavioral health, could you just help us understand the situation that led you to put this one in? And maybe council wouldn't mind speaking to why public waterworks is in under HHS. I think that might help folks in the audience.
Madam Chair, who answers first?
Delegate Scott.
Thank you, Madam Chair. Receivership is an enforcement option in dire situations where the owner of the public or of the water system, known as waterworks, is not meeting critical needs to properly protect public health. Receivership allows Commissioner of Health to petition a circuit court to appoint a qualified waterworks entity or representative to operate the waterworks until permanent solution is found. Right now, Virginia Code only allows for this receivership for private waterworks, and there is no allowance for public or municipal-owned waterworks, and this just brings those public-owned ones in alignment with the private ones. Also, sometimes there's these public-private partnerships. Is it really public? Is it really private? And so this just eliminates that word private to make sure that all waterworks systems fall under that same requirement, and then I'll defer to council to answer the other question.
Delegate Cohen, do you have a follow-up?
Yes, Madam Chair. Sorry. Yes, Madam Chair. I wondered if council could just remind folks why this winds up in HHS.
Madam Chair, Delegate Cohen, VDH has a very wide umbrella in terms of regulating health in the Commonwealth, and under that umbrella is the Office of Drinking Water, which regulates drinking water throughout the Commonwealth in multiple ways, including through not only regulation of waterworks, but also through things like water fluoridation, measuring lead and copper in drinking water. So that's under the VDH umbrella, which is why it ends up landing in HHS.
Thank you. Delegate Henson, you have a question?
Yes, Madam Chair. One, that sounds like a new subcommittee. But my question to the patron, would this change rate increases?
Madam Chair, I'd answer the delegate no. This does not change anything. It's not going to change rates. Everything's going to continue to operate. This is only when a waterworks system is not doing what it's supposed to do, and then it allows for somebody to kind of step in. Again, right now this is allowed for privately owned waterworks systems and facilities for the state to step in, and this just allows the state to step in for other ones that might be owned by local governments as well.
Follow-up, Delegate Henson.
Yes, so to DLS's question and to the patron, how does this interact with the existing VDH enforcement authority? How would this all mesh together? To the patron.
That was, okay. So again, there's already this structure in place. There is already a pathway for this receivership to be done. The courts have to be petitioned, and this is, again, just bringing that process in for the public waterworks, and I know that we have members of the agency here that can speak further to that if necessary, Madam Chair.
Yes.
Hi, my name's Dwayne Roadcap. I'm with the Office of Drinking Water, Virginia Department of Health. This is an agency bill, so we appreciate Delegate Scott bringing it forward to answer the question. We've used this twice in over 20 years, and so usually you're doing it in the most dire of circumstances where the water system has abandoned ownership, where they're not providing adequate water pressure, where they're not providing adequate water quality, they're not adhering to an emergency order from the state health commissioner, or they're not implementing any of the corrective actions that we put through a notice of alleged violation. So in those situations where all of our enforcement and compliance has failed, this is sort of the last option. And so what we're asking is an expanded tool in our toolbox to just make sure that it's available, that we can bring in someone temporarily, put them in front of a court, and do a temporary receiver, somebody who can come in, who can competently run the water system temporarily while we find a permanent solution. So we don't anticipate any additional increased costs, one, because we rarely use it, and two, this would be part of our normal enforcement and compliance duties. Thank you.
Thank you. Committee, any more questions? Anyone in the audience in support of this bill? We already heard. Anyone in opposition? Bringing it back to the committee. Delegate Scott, do you have a final word?
Thank you, Madam Chair. This law builds on last year's General Assembly action to require all waterworks to report to VDH all critical issues. Within 2 hours, last year's bill was about transparency. This year's bill is about accountability. VDH has enforcement and compliance issues for all waterworks, not just privately owned. And we are at the 1-year anniversary of the Richmond water crisis, and that would be an example of where this could potentially take place. Thank you, Madam Chair, and I ask the committee to act favorably upon the bill.
Thank you, Delegate Scott. The bill is before us, and we operate on motions.
Move to report as amended.
Second.
So the motion is report with amendment.
The motion is to report with amendment. All of those in favor? All of those opposed? Oh, we go on the board. I'm sorry.
I'm sorry, I didn't call it attention.
Close the roll. The bill fails to report. 3 to 4 noes. Thank you, Delegate Scott. And with that, is Delegate Anthony here? With that, we will adjourn.